Influenza affects thousands of people every single year, whether it be by taking extra precautions during flu season to ensure that you don't get it, or by taking time out of your busy schedule to get vaccinated, or in fact by actually contacting the influenza virus itself. Today we're going to cover over what is the flu, the impact the flu has on the world and America, the cause of the flu, method of infection, symptoms and diagnosis, and the prevention and treatment of the flu. Before you can prevent or treat it, you must first learn what it is. Influenza is a contagious respiratory illness. It is caused by the influenza virus. 3 separate viruses are in the flu. It's virus A, virus B, and the rare virus C. It can cause mild to severe illness, and at times lead to death. In fact, it is deadly enough to cause pandemics, such as in 1918. In 1919, the Spanish flu killed 500,000 U.S. and 20 million throughout the world. In 1957 to 1958, the Asian flu killed 70,000 Americans. In 1968 and 1969, the Hong Kong flu killed 34,000 Americans. And in 1972 to 1974, we seem to have grasped a little bit of control on it, because over this time span of 19 seasons, greater than 20,000 U.S. deaths in 11 seasons, and greater than 40,000 deaths in 6 of these. That's still a lot of deaths, but it's much better than just 1 out of all of these. And of course, many more hospitalizations, around 110,000 per year. And where does something like this even originate? Through animals. Influenza virus, commonly known as the flu, is an infectious disease of birds and mammals that have the flu caused by the RNA virus. This is commonly confused with a cold. The flu is a much more severe disease that is caused by a different virus than the cold, but has many of the same symptoms. The virus's method of infection is through respiratory droplets caused by coughing and sneezing, sharing drinks or food with an infected individual, or touching your mouth and nose after you've touched something with the flu viruses on it. If you've done any of these methods, usually within a couple of days you will begin to experience symptoms such as fever, which will run typically high, a headache, extreme tiredness, dry cough, sore throat, runny or stuffy nose, muscle aches, and those similar symptoms occur with the common cold. With the flu, they are much, much more severe. Even if you think you have just a common cold, it is important to be very careful of who you're around and what things that you are doing, because you may have many complications. Most adults may be able to infect others beginning 1 day before the symptoms develop, and up to 5 days after becoming ill. The people with the highest risks are 5 years and younger, the elderly, immune deficiency individuals, and people with heart and lung disease. People with these categories are at a higher chance of having other associated symptoms that will cause death, such as cardiac failure, pneumonia, and the majority of deaths are over 65 years of age, and young children with respiratory disease, such as asthma or croup. The best way to avoid any of these complications is to prevent getting the flu. The best method for preventions are rest. The body needs as much rest as possible, and when someone becomes ill, The best kind of rest is adequate to fight infection. Taking in fluids early and often. Essentially, if you feel thirsty, you're already dehydrated as a general rule. Now, when you start feeling as you might be ill, drinking as much water as possible helps by flushing the body of toxins that would otherwise build up. Also, a healthy diet provides the body with proper nutritions and the nutrients that are needed to build an immunity. Vitamin D and vitamin C. A lot of people will up the intake and take supplements of vitamin D and C during flu season. These are essential for building immunity and developing a strong immunity for down the road as well. If after taking all of these things and you still, a lot of people will get vaccinated. The vaccination is an inactivated virus. Because the virus will have an antigen shift, and scientists do not know which one of the antigen shifts it will change to throughout the seasons. Generally, it is a guess of which strand of the A virus, which strand of the B virus will be added to the flu shot. Typically, it will be three strands of B and 2 strands of A for the shot, and 3 strands of A and 3 strands of B for the nasal mist. The recommended the vaccinations are recommended for personnel that are employed in hospitals and outpatient care, employees of assisted living care, and the residents of assisted living, and are also high-risk groups for the vaccinations. I hope that hearing all this today has been able to educate yourself on the information on the flu.